Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Today we're going to talk about the facial mask, which is an orthopedic device developed by Professor Henri Petit of Baylor Dental College in Dallas, Texas. This particular appliance is a new version of an old, relatively old type of orthopedic approach to correcting the problems of children who have an imbalance between the size of their upper jaw and the size of their lower jaw. We're going to be dealing today with this particular type of facial mask appliance, and I'd like to go through the various procedures with a real-life patient and a real-life father and the patient will be getting this facial mask for the first time today. How are you, Stacy?
Fine.
Good. You're beginning to lose a little bit of your shyness, right? Okay. Now, what we're going to be doing today is to deliver the facial mask, but this, in fact, is the second stage of her overall treatment. Now, you remember when we first talked in the initial exam and in the consultation that Stacy has a rather significant problem with regard to her upper jaw and her lower jaw. You remember that, don't you?
Oh, yeah.
Now, she was sent to me by her pedodontist, and I'd like to go over again the problems that she had. This is the initial facial photograph that was taken at the time of the records appointment. And in the facial photograph, you can see very clearly that there is, again, for a girl of her age, which is today 7 years of age, a relative mandibular prognathism and an underdevelopment of the upper jaw, giving her a somewhat prognathic facial appearance. And this is also seen in the front view as well. If we look at the lateral head film, you can also see the underdevelopment of the maxilla and the slight amount of mandibular prognathism evident in this film as well. Now, because of this, she has developed a class 3 malocclusion in which the lower teeth are biting in front of the upper teeth. Now, one further problem that we have is that she does not have any first permanent molars erupted, and the reason for that, of course, is because of her age. So she's slightly delayed in her dental development, and she is also missing a first primary molar, which has been restored with, or has been maintained with a space maintainer, which you can just see the outline on in the dental cast. Now, I made the decision because of her age, because she's getting fairly close to 8, and it looked like there was still a little bit of time left before the first molars were to come in, to use a bonded expander on her dental arch, which would only incorporate the primary teeth and not incorporate the first molars. If I had my choice, I would much prefer to have the first molars in place because it gives it a much better anchor unit. Now, the appliance that we used, and you remember the last time that you were in the office, we put in a bonded rapid palatal expander, which is very similar to this demonstration model here. You recognize that?
Yes.
What this is a wire framework that goes around the outside of the teeth, and there's a jack screw in the middle, which is expanded, as you know, 1 crank per day. And so that the day that this is cemented, and for usually the next month, you or mom or someone will go in, and I'll use this pen as an example of a key that goes in here, and you can see that this would be cranked 1/4 turn every day. And when this is taken out, the key should be in the back of the mouth. The key, of course, is only about an inch long, so it doesn't stick her in the throat. Now, to this particular type of expander is attached these hooks. And this is what we're going to be using today, these facial mask hooks, which will take the elastic. We're going to use rubber bands and take the elastic and run this from the appliance, from the bonded appliance, to the facial mask, which we saw 2 examples of a little bit earlier.
Okay.
Now, I think it would be of interest to, first of all, find out how things have gone during the first 2 weeks when she's had the expander in place. Have you had any pain or any trouble with your expander?
No.
Nothing at all?
I thought you said that the
the two places where the rubber bands fasten onto was hurting your gums. Can you say they were hurting your gums?
Just a little bit? How, but is it okay now? Okay, good. Well, we'll check that when we take a look at your teeth. Now, we put this expander in 2 weeks ago, and you've had your dad crank or your mom crank this every night, right? Have you felt any tingling sensation in your nose at all?
Yes.
Is it painful? Does it hurt?
No.
Okay, that's good. Have you had any trouble as far as expanding the appliance?
No, not well, just a little bit, not much.
Was that, what, mostly in finding the hole?
Just in finding the hole, you know, they have to get it turned toward the light just right,
Okay.
and so you can see it.
All righty. Okay, Stacy, I'd like to use a mirror and see if we can get a view of your teeth with the expander in place, okay? Will you hold this for me for a minute? Okay, tip your head back, open real wide. Now, in looking in the mirror, we see a view of the palate. And in this case, the teeth that are involved are the cuspid, the first deciduous molar, and the second deciduous molar. And on the one side, where the first deciduous molar is not present, we filled that area in with acrylic, because this appliance will be on somewhere between 6 and 12 months, depending upon the speed of treatment. In the frontal view, we can see that her teeth are still in an anterior crossbite position, particularly on the right side. There's a 1 or 2 millimeter midline diastema between her upper central incisors, which again is very common in a rapid palatal expansion type of an appliance. We can also see from the front the 2 hooks which we're going to attach, or to which we're going to attach the elastics. In profile view, the anterior crossbite is still evident, although we're getting closer to an end-to-end relationship. Can you move your jaw any further back than you are now? I think that's just about it. Okay. This is in contrast, of course, to what we see on the original models. You'll notice that there was no space in between the upper central incisors, and the teeth were not nearly as far forward. The upper teeth were not as far forward as they are now. Now, the facial mask comes in 2 sizes. There's a standard size, and then there's a small size, okay? Now, I'm going to try each of these on you. If you'll hold that for me, please.
Okay.
And I think immediately it will become clear that the standard size is too big, because as soon as we do this, we've put a hole in her chest because of this thing here.
Oh,
So
yeah.
that obviously is not the right size. This is too long. And what we will find is that the smaller size, let me sit you up just a little bit, okay? And we'll sit you up there a little bit too. Okay. Now we can see that the smaller size is going to be fitting her just perfectly correctly. And for the most part, these things are very easily given to the patient. There's only one adjustment that you have to make. Now, we can see that the upper part should lie right on her forehead, and this lower part, which is lined with a kind of a foam material, and this also can be supplemented with Kleenex or moleskin or anything of that sort as she wears it and as this stuff starts to wear out. But this should fit quite comfortably on her chin.
The appliance now, is that going to develop a rash or a skin irritation of any kind? Or?
If a patient wears this on a 20-hour-a-day basis, particularly if they've worn it for a long period of time, there's very often a redness when it comes off for 5 or 10 minutes. There are some patients who do develop a rash of some sort, and then we can use a cortisone cream or just lining it with Kleenex or something of that sort, and that seems to work out quite nicely.
Is there any way of cleaning?
You can wash it off, but as far as it's almost better to just replace the this lining with moleskin or something of that sort.
Okay.
Now, what we need to do is to first of all determine whether or not this crossbow part is in the proper orientation. And the way this is done, and if you can turn toward me a little bit, thank you. We should be able to see the elastics, and we're going to use these are 5/16 inch 14-ounce elastics, so that they're very strong. We're going to take one of these. You want to hold this here for me? Well, I'll tell you what, let's just take it off and put it down here for right now. We're going to take one of these elastics as you can see here, I think background on my hand. And we're going to take this, close down about halfway, and we're going to hook it on the hook, okay? And we're going to do the same thing with another elastic. You can do this just as easily with your fingers as I can with this. And then we're going to take the facial mask, and we will soon find out whether or not this is in the right position. You should put your finger pressure on the facial mask. Like so. And actually, now close your lips, please. Now you see this is riding a little bit too high. See how this is riding high in here?
Mm-hmm.
So what I have to do then is to go in and to loosen up. Okay, bite down, please. Okay, I've got to loosen the Allen screw that holds this on and drop it down maybe a 1/4 of an inch.
Okay, now will that have to be adjusted again, or
Hopefully
will it
not.
stay
Oh, it should
pretty
stay.
much there?
Okay. Okay, we're going to take an Allen wrench, put it in here, and drop this down. And we're going to screw it up tightly. It's very important that this remain tight because there's a tremendous amount of force on the elastics. Then we're going to put this thing back in place like we saw before. Close down a little bit. Push them out. There we go. Take this. And we're going to take it like that. Now, that's pretty good. I might just drop this down just a little bit more. No, there, I guess that's pretty good. The main thing that we want to avoid here is to have irritation of this on the lip, and because anything that causes discomfort to your daughter is going to make her not want to wear it.
Right.
And it's the full-time wear with a young lady that has as severe a problem as she has is extremely important, so we do that. So you understand then, we hold this on with one hand and then place these in position with the other, okay?
Now, will they break?
Not very often. These elastics are very strong. If they break, they will, just like in any rubber band, they'll come back and pick her off on the lip a little bit. So when you put it on and when you take it off, and there's no reason why she couldn't do it herself after she learns how to do it, you should be very careful to hold these very firmly with your fingers, as I have done.
Okay.
I want to talk now about the instructions for the appliance wear. First of all, I want you to continue to expand her for about 8 more times, 1 crank per night.
Okay.
And that should get the upper jaw in the right position relative to the lower jaw. Remember, we also have to make sure that we not only get it in the right position the way it is now, but we also have to expect that it's going to be moving forward. And so we'll need slightly less expansion as we move forward rather than if we just left it in the position that it is here. Secondly, and I want you to listen to this for me, okay? I want you to wear this all the time, and you don't have to wear it full time today, because I want you to break as you wear it for the next week or so. I want you to wear it more and more time. Does it feel real tight now? No? Is it not too bad? Because I would expect with all the force in there that would feel really tight. It could very well be that the suture system that holds the upper jaw in place has been somewhat disrupted by the expansion. And therefore, we might be able to see some relatively quick movement, as I would expect. Usually, we see within a month a very substantial change in the position of the upper jaw relative to the lower jaw.
That's good.
Now, do you have any questions about this procedure?
You remember you asked me about wrestling with Stephen, your little brother? She was concerned that he might break the appliance or it might hurt her.
That's a real
Something bad into
good
her.
point. When you have this on, and I can't stress this enough, you probably would do more damage to somebody else than she would to herself, because these things that are sticking out here could certainly poke somebody very nicely. So that whenever you have this on, I don't want you to be wrestling with your brother or anybody else, okay? And you have to be real careful. And if she's out really horsing around somewhere, I would have her take it off, But basically, we want to get 20 hours a day, which
Okay.
gives her 4 hours to eat and to, you know, do the other things that she might have.
Now
There's-
you want her to wear this when she sleeps?
Yeah, when she
Okay.
sleeps as well. So
Now
it's a
she can
full-time thing.
just take it off. Well, yeah, it'd be kind of hard to eat with that on.
Right. Although you'll find that some kids are very ingenious and they don't like to go through all the problems of getting it on and off, and will be able to get. Can you open your mouth for me? See, she can get food in there very easily. Okay, we're going to look at you again and see how much improvement that you've made. And so you'll make sure that you wear it for me, okay? Thank you. Today is June 25th, and it's been about 4.5 weeks since Stacey began wearing her facial mask. How you doing today?
Fine.
Okay. Have you been wearing the mask like we told you?
Yeah.
Okay, I'm going to talk to your dad for a minute about the actual sequence of how you've been wearing it. How's it been going?
Well, I really don't think she's wearing the appliances as much as she's supposed to. She'll take it off to eat, and if I don't watch her, she won't put it on right away. And same way she'll use going in the swimming pool or brushing her teeth for an excuse. And if I don't really keep an eye on her, she won't have it right back on right away.
So what you're saying is that it's not the easiest thing in the world to wear one of these types of facial masks. How many hours a day do you think she's actually getting in?
Well, she's probably getting about a good 20 hours a day.
Okay, so in fact then, if she's getting in 20 hours a day, that's not so bad at all.
No.
And I think that especially during the summertime, when kids are out playing and so on, to get 20 hours a day is actually pretty decent. So I have no real complaints about that. Now, how's it been for you to wear?
Fine.
Has it been okay? Now I can see, and we'll take off your mask in a minute, that this lower part down here looks a little different than we saw it last time. Is that right? Have you had any soreness down in this area?
No.
No? How about redness?
No.
Has she complained at all?
No, the only thing she's complained about is just the chin cup is deteriorated from being wet or from sweating, just from wearing it. You know, and that's the only thing she's really complained about. She hasn't complained about it being uncomfortable or anything like that.
How about roughhousing with her? She has a brother, right?
Right, she has a younger brother.
Any problems with that?
No, you haven't had any problems, have you, with Stephen? Wrestling with you and banging it, have you?
No.
Okay, now you want to, first of all, you can see that the mask itself is fitting pretty well. I still think there perhaps this might be just a little bit too high, and we'll adjust that after we get done here.
Oh, okay.
But basically, I think the mask fits real nicely. Are you comfortable with that like it is there? Now, will you take it off for me? There we go.
Usually just whips it right off.
Yeah, I think the rubber band was twisted. Okay. Now, if we could get a close-up here of the mask, you can see what a mask looks like after it's been worn for about 4 or 5 weeks. Now, this is just tape, isn't it? Some kind of medical tape?
That's mole hair.
Oh, moleskin that's been taped in.
It's moleskin on there. And it looks like she's put some tape on it since I put that on.
Yeah, well, this looks, so I think that looks pretty decent. Now, if we can get a close-up of her chin. Bite down, please. You can see just a little bit of redness around in there, which is very typical of facial mask patients. Now, this morning, just before you came to the TV studio, you went to my office and got an x-ray taken, remember? And I wanted to see in the 1-month period of time whether or not there's been any change in her bite. This is the x-ray that was taken on March 15th, which was basically 2 months before the visit here to the television studio the first time. And in this case, you can see a class 1 to a class 3 type of malocclusion with an anterior crossbite, so that the lower teeth were biting in front of the upper teeth. This is the film that was taken this morning. And you'll notice that there has been a rather dramatic change in both the anteroposterior position of the upper and lower jaw. And also you'll notice that there has been an increase in lower anterior facial height. Now the reason for that is because the appliance itself because of the thickness of the appliance, has caused some downward and backward rotation of the lower jaw. And also we're seeing, according to the tracing, some forward movement of the upper jaw as well. This is the occlusion that Stacey has today, And you'll notice that there is an increase in the amount of overjet, so that it's not a negative overjet like it was previously. And that means basically that her upper teeth are more further forward than they were the last time that I saw her a month ago. This is in contrast to the occlusion shown here, which is taken from the first videotape, which shows her occlusion as it was after the expander had been placed but before the facial mask was being used. Here's the view from the side. You'll notice that the cuspid relationship is more toward class 1 and that there's a positive overjet in the anterior area. This, once again, is compared to the pre-treatment overjet taken at the last session. All right, Stacy, I'd like you to put this back on for me now. Can you do it without a mirror?
Mm-hmm.
Okay. Here's another rubber band. She's a little bit more adept at this than we saw her last time.
Oh, yeah, she can whip that thing on and off like there's nothing to it.
Okay, now once again, we'll drop this down a little bit. And I think that looks fairly decent. Just a minute, let me drop this down one more time. Okay. I think that pretty well does it for today. I'd like to see you again in about 2 months, and we'll see how much more progress that you make. Are there any other comments or suggestions that you might have? What's it been like to be the dad of somebody wearing this? Has it been hard or not?
No, not at all. She does everything she normally does, with the exception of eating, and she has to take it off when she eats and when she goes in the pool.
Sounds good. See you in 2 months, okay? It's been about 3.5 or 4 months now since Stacy has received the facial mask, and she's back today. We're going to take a look and see how things are going and talk to the dad and see if we can make some small adjustments that are necessary on the appliance. How are you today?
Fine.
Okay. Now, have you been wearing the appliance as I asked you?
Yeah.
How's she been doing in that respect since the last time you were here?
She's doing pretty good. She's been real pleased with the way she's wearing
Has she
it.
been getting in the 20 hours or so a day that I've asked?
Yes, she's been doing real good.
Have you found that it's easier for her to get it, to have her wear it during not the summertime, but during the school year? Is this actually an easier time than during the summer?
Yeah, I think so, because she's so busy playing in the summertime that she's always looking for an excuse to take it off.
Okay. Now, Stacy, I want you to let me take a look at the mask. I see a number of things that I perhaps would like to adjust after the appliance has been worn for some period of time. First of all, the upper pad is resting a little bit high on her forehead, and that's been a problem that I have mentioned, I think, in the earlier recording sessions. We also find that the lower pad in here, which in fact has been replaced since the last time we were in the television studio, looks like it's digging in a little bit underneath her lip, although it is not causing a particular problem inside her mouth. The crossbar may be in fact riding a little bit higher than it should, because the elastics, as we can see here, are still pulling up her lips slightly. Now, would you take that off for me, please? Only on television does she have problems like this, right? Okay. Now, we can see once again, in this particular case, that she still has some area of wear in the pad region, and I think this is something that in future models we're going to have to be perhaps concerned with. Now, looking intraorally, we can see that there is now a positive overbite and overjet relationship established. I would estimate that the upper teeth are perhaps 2 to 3 millimeters, the upper anterior teeth are 2 to 3 millimeters ahead of the lower teeth. I might also note that Stacy had a frenectomy carried out in the lower arch about a month ago because we were concerned about the pull of the attached gingiva by the frenum, and I don't think this has anything to do with the facial mask therapy. Now, we can look at her bite in the front view and now compare it to the original intraoral view taken at the time of the first recording session. In profile view, we can see the sagittal jaw relationship, and we notice that the upper teeth are now perhaps even 3 to 4 millimeters ahead of the lower anteriors. We also notice that the cuspid relationship is now class 1, maybe even a little bit toward class 2. This is in comparison to the footage taken on the day of the first recording session. Now, I've had Stacy put the facial mask back on, and I want to address a couple of questions. First of all, we see here that this lower pad is digging in underneath the lower anterior region. I found recently that one of the ways of correcting that is to actually make an additional bend in this face bow that comes down through the center of her face. I want you to take that off for me, okay? Now, one of the things that we actually discussed on an earlier tape is the fact that this face bow, or this center support bar, comes in 2 different sizes, a small size and a standard size. Now, just recently we had a surplus of standard size facial masks in my office, and so I went to the hardware store and bought myself, which is now part of the armamentarium for this, a die and a die holder, and also a tube cutter or a pipe cutter, as you can see here. Now, these may seem like odd pieces of orthodontic equipment, but in fact they are quite useful in adjusting the facial mask. Now, the first thing we want to do is to check the size of the facial mask support bow. And as we saw last time, this is about the right size. If it were too long, or if, for example, you had a standard size bow and you had a small patient, this particular type of device here, the pipe cutter, can be used to actually cut the pipe itself, and then by using the die, as we see here, this can be used to add new threads on the end. Now, I see here that that there's a new part of the appliance that I've not seen before, and this is, in fact, looks like that there's a new screw on here, or a new bolt. Is that right?
Right. That's the only problem we've had with the appliance, is we've lost the bolt off of it a couple of times.
Okay, so what you suggested off camera was that make sure that this gets tightened on very tightly when the patient is in the office, so that this problem does not happen again, right? Okay, now we can take off the lower pad. Now, we can use the die, not in the way that is usually used, because the center part is where the rethreading device is found. But there are also 3 other holes on here. And what we can do is to take one of these holes with the facial mask in through this area. And by using this large fulcrum region, we can place an additional bend in the lower part of the appliance. So this was used to be straight, and now it has a more of a gentle bend to it. Okay, now I've tightened this bolt down securely. Now, would you put it back on? Very good. Now we're not seeing the plastic part digging in underneath the lip, and I think this will be much more comfortable for her to wear. Now, the second part of this whole thing, as far as a major adjustment, has to do with the crossbow. I've had a number of individuals comment upon the fact that these areas here on the ends are very sharp, and as recently as a couple of days ago, through one of the parents, they relayed a message from the teacher to find out whether we could put something over the ends of the crossbow. Now, one other problem with these little kind of depressions in the wire being where they are is the fact that when the elastics are attached, that they tend to come into the corner of the mouth. So in order to solve those 2 problems, I'm going to show you a small adjustment that can be made. The part of the crossbow that we're going to adjust is this S sort of area in here. And the main goal is going to be to continue to curve this around so that this part is not so sharp, and also that the patient will be able to wear the elastics a little bit closer to the midline. Now, most orthodontic pliers are really not strong enough to do this. About the only ones that I've really found are the hollow chop pliers. These hollow chop pliers can be used quite successfully, not only for adjusting, for example, a transpalatal arch, or at least the formation of a transpalatal arch, but they also can be used to recontour the ends of the crossbow. Okay, now we're taking the hollow chop pliers, putting it in here, and then with a great deal of strength and whatever, curving it around like so. So you'll notice that there's been quite a change in the configuration from the S shape, or the curve shape here, to more of a hook shape on the other side. We've completed the bending of the crossbow part of the appliance using another pair of pliers, not of the orthodontic variety, supplied to us by one of the television technicians who felt that this is an easier way to do it, and in fact that is the case. You really need to have a plier of this size in order to make this type of adjustment. Now we've put the facial mask back together. Now can you put it back on for me, please? Does that feel different?
Right here it does.
Does that feel better? Just different, right? Okay? Does that feel okay? No, it doesn't feel okay. All right. What's the problem?
I like them over here.
You liked them when they were out there. Okay. Well, we can fix that for you. Never fails. Anyway, this is basically the design that we're looking for. These things are now not protruding outward, and there's much less of a problem with the corner of the mouth being affected by the appliance. I want to thank you both for coming today, and I think this again will be very helpful in teaching other people how to use the facial mask. We've gone about 3 or 4 months now, and I'm very gratified with the results, and we'll try to look at her again in the future to see how the overall treatment came out. Thank you very much. Thank you, Stacy.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.